I can tell on the first visit whether someone is going to get better. Why? Because I avoid the 5 pain management mistakes that keep people suffering. I'm Dr. Sudhir Rao, triple board certified in pain medicine, anesthesiology, and functional medicine. I've treated over 50,000 chronic pain patients. One of the 5 mistakes is something most chronic pain patients are doing on their doctor's recommendations right now, and it's making their pain harder to treat every month. I'll show you which mistakes are most likely keeping you stuck, what to stop immediately, and one change you can make before your next appointment. Point number 1, you're treating symptoms without finding the root. You can get an MRI or an X-ray, and it shows something. Your doctor gives you a diagnosis and a prescription, and you think now you're on the right track. You assume that treating the thing in the image will fix your pain. That's how it works, right? You identify the problem and you solve it. Here's what actually happens in the system. The doctor treats the image, not the person sitting in front of them. They completely ignore how you sleep, what your metabolic markers look like, whether you have any hidden inflammation, or how stress is affecting your nervous system. When you only treat the symptom without understanding what caused it in the first place, the pain either comes back stronger in the same place or it moves somewhere else entirely. Your body is telling you something is wrong, and if you only silence the messenger without fixing the message, you haven't solved anything long term. When you treat the symptoms without finding the root, you guarantee the pain will either come back stronger or migrate somewhere else. You need to insist on root cause analysis. If a doctor sits across from you and can't explain why you specifically have this pain, then they also can't fix it. Instead of getting a temporary fix that wears off, your treatment actually needs to work. The second mistake is even more hidden. Your doctor doesn't even know they're making it. Point number 2, you're using incomplete labs that miss what's actually broken. Your doctor runs a CBC and a basic metabolic panel. Everything comes back normal and you feel reassured. Your body must be fine. The labs don't show anything wrong, so the problem must be something else. Standard labs were designed to diagnose disease, not to understand how well your body is actually functioning. They completely miss the information you need. You can get normal results and still be broken in ways that are causing your pain, but nobody ever tells you to look. You can't fix what you don't measure. You need comprehensive micronutrient panels that show you exactly what your body is depleted in. You need inflammatory markers that reveal what's actually happening in your system. You need hormonal status, screening for hidden infections, and metabolic function tests. That's the difference between getting results that say your labs are normal and hearing the words, "Now I know exactly what to fix." I see the same patients with the same pain, but completely different results once advanced testing has revealed what's actually broken. You move from hoping something will work to knowing exactly what's wrong. The third mistake is what happens after you get those incomplete labs. If you're recognizing yourself in these patterns, subscribe. I put out a new video every week on what actually moves the needle for chronic pain, and the next few ones are ones you'll want to see. Now let me show you the third mistake. Medications have a place, and they are a piece of the puzzle. Most patients end up on long-term opioids or gabapentin, and nobody ever sits down and explains to them what's really happening to their body. Here's what the medications are actually doing. They block the pain signals, but they don't heal anything. The longer you stay on them, the more your nervous system adapts and the more you need them to feel the same relief. Your pain baseline rises with tolerance. You end up needing higher and higher doses of something that isn't actually fixing the problem. Have you been on pain medications for longer than 6 months with minimal changes except that you need more of it? Did anyone talk to you about long-term opioid use may actually be increasing your pain sensitivity? Do you know that long-term gabapentin can fog your cognition and long-term anti-inflammatory medications can damage your gut lining and your kidney function? If nothing has changed except that you're needing more medication, then the medication now has become part of the problem. And then people move on to the next mistake. They skip the option that actually works and go straight to the one that may damage you permanently. Surgery should be the last resort in almost every case. Now, granted, there are times that surgery is immediate and emergent. But if that's not the case, then surgery may create scar tissue and cause permanent anatomical changes that are irreversible. There are regenerative approaches available right now, like PRP, exosomes, peptides, and targeted injections that you should explore before you even consider surgery. These work with your body's own healing system instead of against it. I had a 50-year-old exec who came to me headed for joint replacement. We did PRP and exosome injections, and he regenerated enough that he didn't need the surgery. That's a real result. That's his body healing itself with the right stimulus and the right support. Stop assuming that surgery is the only option after you've exhausted everything else. That's just not true. There are other options that are available. Explore regenerative approaches before you even consider surgery. The clinical results are astounding at times. Mainstream science is still catching up, but we are seeing exceptional results with regenerative approaches. Your body knows how to heal if it has the right tools. That brings us to point number 5. You're not treating the inflammation that's probably the actual root cause. Chronic pain is inflammatory, metabolic, and lifestyle driven. The root causes are inflammatory foods, poor sleep, high stress, inadequate movement, and metabolic dysfunction. Most doctors approach this with pills and procedures without ever touching the actual cause. Think of it like this. Your house has a roof leak, so you patch it. The water stops dripping for a while, but your gutters are still getting clogged, so water's overflowing and pooling in your attic. Water is now running down the walls. You patch the roof again, and the water still damages the house. You can put 100 patches on that roof, but the water will still damage the house as long as the gutters are clogged. Treating pain without addressing inflammation is exactly the same thing. You're fixing the symptoms while ignoring the actual problem that keeps generating the symptoms over and over. I've seen patients who've been told to accept their pain as permanent. 6 months into an integrated anti-inflammatory protocol, diet cleaned up, sleep optimized, inflammatory markers addressed, their pain was cut in half. Not because we found a miracle procedure, because we stopped feeding the inflammation that was keeping their nervous system in alarm mode. That's what changes when you treat the actual cause. Here is where you start tonight. Look at 3 meals you ate today. Processed foods, sugars, seed oils, refined carbs. Write them all down so you can see the pattern. Check your sleep last night. If it was less than 7 hours or poor quality, that is a major source of inflammation in your body. Plan one specific change for tonight that you're actually going to do. Find one moment of stress today that could be reduced or removed. Stress causes inflammatory processes throughout your body, and you need to be able to manage that better. The system is designed to manage pain, not cure it. That is not conspiracy. That's just how the system works. Doctors do their best within the system they're in, but the system itself is not built to address root causes. Once you stop making these 5 mistakes and start addressing what's actually causing your pain, your body can actually begin to recover. The capacity to heal is there. You just have to point it in the right direction. If you want the specific anti-inflammatory habits I personally use and recommend to every patient I see, which is in the next video, I broke down the 7 daily habits that bring inflammation markers down in weeks. The link is here.